Good afternoon and welcome to today's edition of Discovery Hour with SpectraCell Laboratories. This month's topic is telomere testing and basically trying to show providers how they can utilize these tests for their patients. And for those of you that are customers and have been invited to this webinar, hopefully you will have a greater insight on telomere shortening and how it can benefit you to understand this information and be able to improve your quality of life. So today's presenter is Dr. Ybarra, but before I get there, let me go ahead and introduce you to SpectraCell for those of you who aren't familiar with our laboratory. SpectraCell was established back in 1993, which means we're a little over 30 years old. We're not new to the industry. We're definitely not new to the testing that we provide. We're based in Houston, Texas, which is home to the world-renowned Texas Medical Center, which shouldn't surprise you by giving us the access to a much higher degree of technology and healthcare professionals as we've launched this amazing laboratory that I'd like to consider a boutique laboratory because of the specialized tests that we offer. But it's not just the tests that we've been doing for the last 30 years as we continue to improve on techniques and instrumentation and all of those things. So we are a CLIA certified lab. We have performed well over 1.2 million tests in these last 3 decades and have now established global relationships around the world. So we're not just servicing the United States, but also Canada and providers throughout the Caribbean and Central and South America, throughout Europe. Some of our furthest accounts are in the Middle East, in Dubai and in Israel. And just here recently, we've opened up our markets in Southeast Asia, in Hong Kong and Taiwan, and branching off into Japan as well. So again, my name is Javier Sandoval. I'm the National Sales Manager. Thank you for taking time to join us today. Again, thank you to Dr. Ibarra for doing the presentation. So let me go ahead and introduce him as our speaker for today. So Dr. Ibarra is a career emergency medicine physician. He's a multi-boarded physician who's turned his efforts now to population health management. Human longevity has been a special interest of his, which is one reason why we felt he was kind of natural for providing his insight on telomere testing, since it's something he's been doing since we established and the first were to commercialize telomere testing about 10 years ago. Graduate of Houston Baptist University, received his medical degree from Baylor College of Medicine. He's a residency in family medicine, emergency medicine through the UT Health Science Center, board certified in travel medicine and forensic medicine, and also a board certified physician in sports medicine. So with that being said, I'll go ahead and turn it over to Dr. Ibarra and let him begin the telomere presentation for you today. Everyone sit back and enjoy. No need to take notes. We will provide you with the recording and the slides at the conclusion of the presentation. Enjoy.
Thank you, Javier. My name is Dr. Ybarra. As I've been introduced already, you know my credentials. Overall, I've been a physician for 38 years, and my interest really now has sort of evolved to population health. And when I say population health, I'm talking about treating a whole community. For instance, I live on South Padre Island. I'm very concerned with the overall health of the island. Um, and in population health, we worry and we're concerned about basically three different issues. Uh, One is obesity, which in the United States is about 43% or so of people are obese, BMI over 30. And then longevity, and in the United States, the average age for men to expire is 73 to 75. Women a little bit longer, maybe 79 to 81. And then the third thing is mental health, and there's a high percentage of that in the 20 percentile or so, something like that. So what I want to do in this discussion is really talk about longevity, and as a physician, we want to measure or have a measurement that could help us determine longevity for individuals. And so since 2013, I've been using a test by SpectraCell called or checking for telomere length. And we know that telomeres are sections of the DNA, basically the protective cap at the end of each chromosome. It's kind of like with shoelaces. the tip of the shoelaces. It protects the DNA, and each time a cell divides, the telomere shortens. And when they shorten, they can no longer protect the DNA, and that can lead to cellular death and aging. So, and we know from statistical analysis and research that longer telomeres indicate a younger age, and so it's a good biomarker for longevity. So that's essentially what we're going to be talking about today. Is as a physician, how can we determine a patient's biologic age as opposed to their chronologic age? And we always want the biologic age to be younger than the chronological age. So why does telomere length matter? Basically, we know that there's an association between the telomere length and certain health conditions. For instance, shorter telomeres are correlated with certain conditions like hypertension, diabetes, obesity, atherosclerosis, vascular dementia, heart disease, mortality. So the shorter your telomere, the more likely you have one of these disease entities. Of course, as a physician, we always want to influence a patient's health by helping them have a good lifestyle. So lifestyle changes, exercise, diet, stress reduction, etc., is sort of the name of the game. And by doing this, we can hopefully affect the telomere length. And this is, again, a measurement that we do periodically with the patient. We also know there's an inverse relationship between the other borderline issues like glucose levels, insulin, blood pressure, artery thickness, and inflammation. So again, we measure the telomere length to give us a correlation on the patient's longevity. The longer the telomere, the better. The shorter, not good. And so as a physician, we have to look for issues that we can influence. And again, it's all about lifestyle and just living a healthy healthy diet, healthy exercise, stress reduction, etc. So age and gender can affect telomere length. Uh, Body size and whether you have a lot of inflammation um, will shorten the telomere length. It can also vary by gender. The length is more pronounced in men, and so um, under the age of 73 is where we really want to. These are the individuals we really want to measure the telomere length. Increased risk for those under 73 if you have a short telomere. Uh, so again, the main thing is it's sort of a marker. So if you're a physician, you want to have indices that you measure to help a patient and to influence a patient's um, longevity. This way, when you have the measurement, you can then interview the patient and ask about those type of things, especially oxidative stress, inflammation, and cardiovascular disease. We know in the United States that the major mortality is cardiovascular disease and cancer. So we know that inflammation from various sources can cause these chronic diseases. So the rate at which telomere shortens is accelerated by those type of things that will cause inflammation. This graphic here is a good summary of the type of things that cause inflammation. And there's a lot of inflammatory diseases. You think of autoimmune diseases, arthritis, but also pulmonary diseases and cancer. So when an individual has these type of inflammatory diseases, the telomere shortens. So whenever you order a telomere test, uh, your result is going to come out on a graphic such as this. This image shows a representation of the patient's average telomere length. So as you can see, as you get more mature aged, uh, the telomere length will naturally shorten. So you want to be able to be above the line um, indicated here. So the younger the cells are collectively. So it's an aggregate of the cells when it's the T lymphocytes that are measured in the lab. So what can a physician do to leverage the telomere test results? Of course, we all know our chronological age. We want to be, again, our biologic age should be younger than our chronological age. And so when a patient's telomere length is short, of course, we ask about lifestyle habits, again, exercise, diet, uh, nutrition, and stress management. The other thing that's really important is optimizing personalized supplementation of their micronutrients and vitamins. So one of the tests that's an ancillary test to the telomere test is the MNT, which actually measures the vitamin and mineral levels at the cellular level. Most of the time physicians will measure vitamins in the blood, but this is not the very accurate measurement. You can kind of compare it to a hemoglobin A1C versus just a plain blood glucose. So a hemoglobin A1C will give you sort of the average glucose level over a 6-week period, whereas if you just do a blood glucose, it's just that immediate uh, result at that moment. So the other thing that can influence the telomere length is genetic influence. So if you have a family history of longevity, then many times you'll have a longer telomere length. Again, it works synergistically, genetics and lifestyle. Um, so again, it's a way to test patients over time. So generally, it's sort of an indicator of a patient's overall health. So there's also nutritional implications on the telomere length. Again, inflammatory diets can decrease the length of the telomere. So you want to avoid uh, highly refined carbohydrates, fast foods. Definitely, you want to sort of stay away from that. Sodas, and then artificial sweeteners, trans fats, and saturated fats are will cause inflammation. So you want to stay away from those. Now, on the flip side, there's antioxidant-rich diets, um, and you want to supplement those type of foods. It'll give you an oxidative defense when you do that, and so, and then the other thing that you want to do is preserve the telomere length, and one of the ways you can do that from a lifestyle perspective is fresh fruits and vegetables, uh, fiber, micronutrient supplementation, monounsaturated fats, omega-3 fatty acids, cold water fish, uh, and high quality vegetable proteins. Um, the other thing is to reduce caloric intake. So uh, it's recommended that there be some fasting thrown into your lifestyle for at least 12 hours at nighttime is recommended. So you also want to reduce the rate of telomere loss. So this is oxidative stress. Again, we've talked about this. The telomeres are very highly susceptible to oxidative stress, and this will shorten the telomere. You want to correct any micronutrient deficiencies, especially vitamin D. I can't emphasize enough that lifestyle changes have to be encouraged, and we're talking about physical activity, and it's recommended that you get at least 30 minutes of cardio per most days of the week, and you try to avoid obesity by limiting your dietary intake. Um, Insulin resistance can also cause telomere shortening, so you want to make sure that you correct insulin resistance. Again, the telomere length is correlated with certain chronic diseases like cardiovascular disease, etc. So again, you want to have a longer telomere. You want to reduce cardiovascular risk and other chronic diseases like hypertension, obesity, absolutely stop smoking. Um, you want to optimize your sleep, exercise, stress reduction. These are all ways to influence the telomere length. So in addition to telomere testing, other relevant tests that SpectraCell does is micronutrient testing, lipoprotein particle profile, and the MTHFR genetic testing. These are all supplements to uh, helping a physician or provider uh, help a patient uh, to again live longer. We're talking about longevity and the tests that can help us uh, modify or influence a patient's longevity. A question many times asked is when should retesting be considered? And we generally say at least once a year if everything else is normal. Now, if you find something that needs to be corrected, like hypertension or diabetes or um, obesity, then you might want to retest a little bit more frequently. I know I have some professional athletes that actually get tested about every 3 months. Again, these are high performance individuals that want to function at their peak. I mean, we're talking about professional athletes, Olympic athletes, etc. So, just to put some context to this, I had a telomere test. I'm 66 and I have some chronic diseases. However, I've always had a healthy lifestyle. I'm a marathon runner. I've run 59 full marathons. A couple of years ago, I climbed Kilimanjaro. Um, but despite the healthy lifestyle, I still have had some chronic diseases. Fortunately for me, the lifestyle um, optimization has kept my telomere result at a high level. I've been testing myself since 2013, and it's always been over 10. Recently, my result was 12, uh, which puts me at a younger uh, biologic age than my chronologic age. My wife, who's much younger than me, also had a telomere test. She doesn't exercise as much, but she's young and beautiful. And her telomere test was also at a very high level. It turns out her family history is also very optimal for longevity. Even though there's some chronic diseases in the family history, on the most part, her relatives have lived into the 90s. Her grandparents, for instance, are both in their 90s. Well, her grandfather passed away just recently, but he was just shy of 100. So uh, again, so age makes a difference, but you want to stay biologically young, and no matter what your chronologic age is. And to do that, lifestyle optimization and and uh, and then micronutrient optimization is important for this. And again, all of this is just a measurement that will help a provider, a physician, um, help a patient by giving them specific metrics to have measured periodically. Um, so, in summary, the telomere test is a measurement of biologic age, and the length of the telomere is what we're looking at. The longer the telomere, the younger person is from a biologic age standpoint. Uh, it can also be a way that we can tell if there's some disease entities that are affecting the telomere length these chronic diseases that we talked about. As a provider, I want to help a patient influence their lifestyle, so that when we do the test, it'll be it'll be a longer telomere length, which is again correlated with longevity.
Dr. Ybarra, thank you very much. That was a wonderful presentation, and we appreciate you taking time out of your busy schedule. For those of you that were watching, you may not have realized, but he was actually in the emergency room while he was doing this, and we appreciate his time and effort. For those of you for taking time out of your busy schedule, we'd like to say thank you to offer you a coupon code. This coupon code for watching this presentation is TM for telomere, so TM10. That'll offer you 10% off of the website for those of you that are going to be placing online orders. And for our providers that are going to be providing this to their patients, just write TM10 in the special instructions section on the requisitions as you're sending them in. That's going to be off of the test that we talked about today, which was telomere specifically, but he also addressed micronutrients and the importance of micronutrient testing to help slow the aging process and to improve telomere length. We've also have a combo test that is called Age Nexus. So if you're interested in having both the telomere and the micronutrient test performed, you can actually just order that one single test, which is Age Nexus. The other test that he talked about that affects telomere shortening is also the MTHFR gene mutation. You could order that individually as a test on our website or on the requisitions, but we also have a combination test that is called Cardiac Nexus. For those of you that might be concerned about cardiovascular issues, basically addressing those by looking at our lipoprotein particle profile. It's much more sophisticated than just a standard lipid panel. So I encourage all of you to visit our next generation website that just launched several weeks ago. It's much more informative, has some amazing instructional videos about each of our tests to give you a greater insight in the depth and magnitude and the sophistication of the tests that we offer at SpectraCell that are cutting edge, unlike any other lab that can provide a test like ours. So I invite you to watch those videos. There's drop down boxes that go into much more detail on each of the tests, and we hope that you will find very helpful in making your ordering decisions. So again, thank you very much for taking time out of your schedules. My name's Javier Sandoval, the National Sales Manager from SpectraCell Laboratories, signing off from Houston, Texas. Bye-bye.